Welcome back to Understanding Special Education in the DDSB series, Part 3. This portion is centered on helping parents and guardians understand IPRC and the decisions they make as per Regulation 298 of the Education Act. These strict guidelines outline the process for identifying a student with a specific exceptionality designation and a placement for their education pathway within a school board. The Durham District School Board acknowledges that many Indigenous nations have long-standing relationships, both historic and modern, with the territories upon which our school board and schools are located. Today, this area is home to many Indigenous peoples from across Turtle Island. We acknowledge that the Durham region forms a part of the traditional and treaty territory of the Mississaugas of Squaw Island First Nation, the Mississauga peoples, and the treaty territory of the Chippewas of Georgina Island First Nation. It is on these ancestral and treaty lands that we teach, learn, and live. The Durham District School Board is committed to learning environments that are safe, welcoming, respectful, equitable, accessible, inclusive, and free from discrimination while placing human rights and equity at the center. So what is an IPRC anyway? IPRC stands for Identification, Placement, and Review Committee. This is a team brought together to support decisions about a student who requires an Individualized Education Plan, or IEP, to support their learning needs. This team consists of a minimum of 3 Durham District School Board staff, usually from the school your child attends. At least one of the team members must be a principal, vice principal, or supervisory officer, and they are the chairperson of the meeting. Activated members of the Inclusive Student Services team may also join this meeting to answer questions, provide insight, and support decision-making. We also hope that all parents and guardians, as well as students who feel comfortable, join this meeting, as these voices are an important part of finalizing the identification and placement decisions. Parents and guardians can also invite any advocates or community support staff who have important information to be able to share as part of this meeting. Let's talk about the purpose or goals of the IPRC meeting. The committee meets with the goal of 2 decisions. The first is identification, whether to formally identify your child as a student with special education strengths and needs, and in what area. The Ministry of Education has very specific categories we can use for this identification, which will be explained in the next slides. The second decision is about placement. Again, there are very specific guidelines from the Ministry about the types of placements we identify through IPRC, but it is important to note that each individual board uses these guidelines to formalize internal practices, and there may be slight differences from board to board as a result. The IPRC documentation also includes the specific listing of strengths and needs for your child. These 2 lists should be balanced, skill-specific rather than generalized, and incorporate any assessment or testing done by clinicians or education staff to ground them in evidence. Parent or guardian input is an important part of creating this list. Sharing of relevant information from any external sources, as well as experiences outside of school, helps us to ensure the list is capturing the strengths and needs clearly and accurately. Let's talk about the ministry categories for exceptionality. Sometimes there can be some confusion about which exceptionality should be selected during the IPRC process, so hopefully this will provide some more clarity for you. But as always, should you continue to have questions, please don't hesitate to reach out to your school team. It is important for all parents and guardians to know that we can only select from this list, and that the guidelines for each category are clearly laid out for school boards. There's a lot of information here, so feel free to pause, rewind, or replay this video to review at any time. The intellectual exceptionality is selected for students when the cognitive and intellectual areas are impacting the learning needs. This can be at the gifted level, where students' intellectual and cognitive ability are at the very high end of the scale, or for mild intellectual disability, cognitive and developmental disabilities that challenge a student's ability to access grade-level curriculum. The physical exceptionality category is selected when a condition of severe physical limitation or challenge creates a need for assistance in learning in order to provide access to these learning opportunities. Blind and low vision needs, which involve a partial or total impairment of sight or vision, are also captured with this category. The behavior exceptionality is selected when a learning disorder that includes specific behavior problems over a period of time to an intense degree and that affect a student's educational performance occur. This can include an inability to maintain or build relationships, excessive fears or anxieties, a tendency for a compulsive reaction, an inability to learn that isn't tied to intellectual or sensory needs, or other health factors. The communication exceptionality category is selected for the autism spectrum disorder diagnosis, for students who are deaf or hard of hearing, or for students with a speech impairment diagnosed by a clinician. This category is also selected for students with a language impairment where comprehension and/or the use of verbal, written, or other forms of communication has been diagnosed by a clinician. A learning disability that is evident in both academic and social situations and diagnosed by a clinician falls into this category as well. In the Durham District School Board, a 2-year learning gap between the age of the student and the grade level of the student and assessed learning levels may also be used as evidence for this exceptionality. Typically, a CATIA or psychoeducational assessment is needed to make this decision without a learning disability diagnosis. When a student has needs that extend beyond one ministry category, the selection of multiple exceptionalities is made. This will be documented by listing the specific areas of need with the most significantly impacted learning need identified first, and other categories listed in order of impact on learning. For example, multiple exceptionalities with communication, learning disability, and behavior would be a combination identified for a student who may have learning needs in the learning disability category, as well as some significant worries or anxiety. An IPRC meeting isn't the only way to be able to meet with the team of people that supports your child when they have been identified through IPRC. Sometimes what is needed is the group to come together to discuss the child's needs and current challenges, but we know the placement and identification makes sense for the student. A case conference is an informal meeting focused on problem solving that brings anyone who is actively supporting your child together. The goal of a case conference is to better understand the child's current needs, explore possible interventions or supports not yet in place, activate community supports if appropriate, and narrow down what the most pressing need is and what strengths can be leveraged to help address it. A case conference can be asked for by a parent or guardian or set up by the school throughout the school year. It can be a great opportunity to share some new information or assessment that wasn't previously available, or to just bring the team together to brainstorm and problem solve. Sometimes having a case conference before an IPRC meeting is helpful to discuss any questions or concerns so that the IPRC meeting itself stays focused on the goals of identification and placement.